Let's begin our lecture about the disorders of esophagus. And in the first section of this lecture, we will talk about the condition known as acute esophagitis. And in this, we will talk about what is acute esophagitis, what are the different complaints of the patient with acute esophagitis, or how the patient present with acute esophagitis. And also another very important, what are the causes of acute esophagitis and how we can diagnose and treat this condition. So acute esophagitis, as the name show, acute means it's of short duration, not the long duration. Esophagitis, itis is the inflammation. So it's the inflammation of esophagus, which is a tube that transfer the food from the oral cavity to the stomach. So it's the inflammation of esophagus, which is a long tube. So inflammation, acute, remember it's acute esophagitis, not chronic. We are talking about chronic is long duration, long-term, long-standing condition. Acute is short-term, short-standing condition. So it's the acute inflammation of the esophagus known as acute esophagitis. It is the causes of acute esophagitis can be due to ingestion of hot liquids. Sometimes when we drink hot liquids like very hot tea and coffee, that can cause the acute esophagitis. So ingestion of hot liquids. Ingestion of caustic or corrosive agents also can cause acute esophagitis. So this is the two conditions, very common, hot liquids and the ingestion of caustic or corrosive agents that can cause the irritation of the lining of the esophagus, mucosa of the esophagus, causing acute esophagitis. Also laceration due to swallowing of the foreign body or trauma. So that's also another condition, laceration or injury, when sometimes foreign body is swallowed, or if there is trauma, sometimes also due to some surgical procedures in which some tube is inserted in the esophagus or that goes into the stomach on the way, can cause laceration of the esophagus leading to acute esophagitis. Monilial infection from thrush in oral cavity. Monilial fungal infections, candida infection causing oral thrush is very common. That can sometimes cause acute esophagitis. Then some systemic disorders like pemphigus disease can cause acute esophagitis. So very, very common causes of acute esophagitis, ingestion of hot liquid, very common. Sometimes accidentally we drink very hot liquid, hot coffee, hot tea, that can cause the laceration of the esophageal mucosa. Laceration due to ingestion of foreign body or trauma. Then ingestion of caustic or corrosive agents. Monilial infection, fungal infection, as a result of oral thrush, and then systemic disorder like pemphigus disease. The complaints of acute esophagitis, how the patient with acute esophagitis will present. Dysphagia, difficulty in swallowing is there because of the laceration of the esophageal mucosa, can cause dysphagia, difficulty in swallowing. This is difficulty, phagia is swallowing, so there is difficulty in swallowing. Retrosternal burning. Esophagus is when it goes, it's in the chest. Also, thoracic portion of esophagus, when there is laceration or injury, it causes retrosternal burning behind the sternum. There is the heartburn. So it's called the heartburn also. Retrosternal burning is present. You can see that's how the patient usually present. They have retrosternal burning. Then there is hematemesis. There is blood in the vomitus present. If the patient vomit, usually they have blood because the blood comes from the lacerated mucosal lining of the esophagus. The condition which is very common that can occur as a result of acute esophagitis, and once it occurs it can further aggravate acute esophagitis, is the perforation of esophagus. So when the lining of the esophagus become thin out as a result of ingestion of caustic substances or hot liquids, that thinning can predisposes the esophageal lining to perforation. And then different procedures that can be done to diagnose acute esophagitis can also lead to the perforation of esophagus. So important to remember that it can be the cause of acute esophagitis or it can occur as a complication of acute esophagitis. So both ways it can occur. Perforation can occur of the esophagus as a result of acute esophagitis. Different procedures performed to diagnose acute esophagitis, and then it can occur once the rupture occur. It can itself lead to acute esophagitis. So it's a both way the perforation of the esophagus. It can be as a result of instrumental trauma when different procedures are performed and then different instruments are inserted into the esophagus. It can cause the perforation or rupture of the esophagus. So esophagoscopy is one procedure or instrumental trauma in which the esophagus is examined with the help of esophagoscope. Then we have dilatation of strictures with the bougies. These are the instruments that are inserted to dilate the esophagus to remove the stricture or cause dilation of esophagus. So this can also lead to the perforation of esophagus. Then the common site or the rupture in this case is the above the sphincter or it's above the upper sphincter. That's the common site of the rupture. Rarely in lower esophagus. So it's rare in the lower esophagus. It's common in the areas above the upper sphincter. Then the esophagus can rupture spontaneously. As a complication, I mentioned there is hematemesis occur in acute esophagitis. So when the person try to vomit forcefully through the esophagus that has strictures, that's narrowed, that is stenosed, as a result of the complication of acute esophagitis, then it can cause spontaneous rupture also. So follows the vomiting. Involve lower third of esophagus, and it's a post-emetic rupture of all layers. This can cause the Boerhaave syndrome. So Boerhaave syndrome is when there is rupture of all the layers of the esophagus as a result of forceful vomiting. So, very important, rupture of the esophagus, perforation of the esophagus can occur as a complication of acute esophagitis, ultimately can cause acute esophagitis. It can be a cause or complication, both sides. Then how we can diagnose this condition? Early diagnosis is very important for the perforation, can lead to itself so many complications that can be sometimes very, very serious and life-threatening. So early diagnosis is imperative. Then the esophagoscopy is the procedure performed for the early diagnosis, in which the instrument known as esophagoscope is inserted in the esophagus. Suspected of perforation, whenever perforation is suspected, we should do esophagoscopy. Features of cervical esophageal rupture. As I mentioned, esophagus is a long tube, so it has cervical portion that is in the neck and thoracic portion that is in the chest. So what are the features of perforation of esophagus that is in the cervix or in the neck region? There is pain, very bad pain, especially on swallowing, they have pain, and there is fever. Whenever there is infection or inflammation, it can cause fever. Then we have difficulty in swallowing because of the pain, because of the inflammation, laceration of the esophagus. There is local tenderness. So when we touch the cervical region, there is tenderness in the local region. Then we have signs of surgical emphysema in the neck. So these are some features of perforation of cervical esophagus. Then there is features of thoracic esophageal rupture. We have pain which is referred to the interscapular region. There is pain because now it's in the chest. It goes back. Pain is radiated backward and it is felt behind the scapula on the back. Interscapular pain in the region behind the scapula. So there is between the scapula, so it's interscapular pain. Fever is usually high. There are signs of shock, low blood pressure, high fever. These are the serious features. Then there is surgical emphysema in the neck. There is emphysema, collection of the air. You can see the whole face and neck, and this is all swollen. So surgical emphysema is also present because there is rupture of esophagus in the chest region, thorax. There is also crunching sound over the heart. This is known as Hammond's sign. So crunching sound over heart. Then we have pneumothorax, which is the air in the chest. So all these are the complications associated with the esophageal rupture in the thorax or thoracic esophageal rupture. There is high fever, pain, there is surgical emphysema in the neck, there is crunching sound over the heart is present, and there is pneumothorax, presence of air in the chest. X-rays of the chest and neck. What are the features or the diagnostic procedures that help us to find out the condition or find out the rupture of the esophagus? X-ray of the chest and neck, which reveals what we will find in the X-ray of the chest and neck. There is widening of mediastinum and retrovisceral space. So there is widening of the mediastinum because of all the effects that are associated with the rupture, like emphysema, pneumothorax. There is widening of the mediastinum. Surgical emphysema, pneumothorax, and pleural effusion or gas under diaphragm. Very first important diagnostic procedure that tells us about the perforation is the gas under the diaphragm. And that's very initial basic investigation test. Okay, send the person for x-ray, and on the x-ray, if there is gas under the diaphragm, that is the indication that there is perforation present. So this is very initial test. Treatment, how we can treat the condition. Oral feeds stopped immediately. First thing, immediately no oral feeds are given if there is perforation or rupture. Nutrition through IV route is given. Massive doses of antibiotics to prevent any infection that can occur. Conservative measures, drainage required if suppuration develop, and retrovisceral space and upper mediastinum is drained. So all these are the treatment steps or management steps that we should take. Right away stop the oral intake. IV nutrition or IV should be given. Then we should give the antibiotics to prevent any infection or suppuration to develop. Conservative measures are given to bring the patient condition to a little better before the surgery can be performed. For rupture, there is no definitive therapy other than the surgery. But before that, the patient condition should be stable, so we need to treat the patient conservatively. Then the rupture of thoracic esophagus, diagnosis made early, within 6 hours. The treatment will be different if it is diagnosed early or if it is diagnosed late. So diagnosis made early, within 6 hours. Perforation, repair surgically. Pleural cavity is drained. If diagnosis is delayed, repair not possible. So it's very imperative or important that we should diagnose the condition fast. And usually it is diagnosed really fast because the condition of the patient is bad. And when the x-ray is done, simple investigating procedure, there is gas under the diaphragm, other condition, and the patient should go for surgery right away. So within 6 hours, before 6 hours surgery. If late, repair is not possible. Surgery restricted to drainage of infected area. So we should drain the area which is infected. So that was all about acute esophagitis and the perforation and rupture of esophagus. Thank you for watching sqadia.com.